going into a burning building to rescue somebody, they're putting themselves in danger also. And so that's part of the difference in when you're treating a first responder, you're treating their traumatic experiences um, from really two different directions.
Welcome to Disruptors at Work, an integrated care podcast. Today, we are exploring behavioral health support, trauma, and resilience within first responder communities. Let's get started.
Welcome back to Disruptors at Work, an integrated care podcast. I am Dr. Cara English. I'm the CEO and Chief Academic Officer at Cummings Graduate Institute. And here with me today is Dr. Jackson Williams, one of our original CGI Doctor of Behavioral Health alumni, and now serving as a mental health clinician with Public Safety Psychology Group in New Mexico. So welcome, Jack.
Thank you. Good morning. It's good to see you.
Great to see you too. So here today, we are talking about a very special project that will be premiering soon in New Mexico, which is The Call, a documentary which is focused on the mental health and trauma that are related to doing the job of being a first responder. And you have some special personal and professional experience in that area. So I was wondering if you could tell us a little bit about your background as a firefighter and a special agent, and how that led you to your focus now on behavioral health and mental health for first responders.
Sure. So I joined the Air Force in 1976. It seems like such a long time ago, and things have changed so much since then. But it was my first enlistment in the Air Force. I was a firefighter. I had the opportunity, unlike fire departments today, in the Air Force back then, and even in civilian fire departments, they didn't train firefighters as EMTs. It was kind of something that was slowly happening, but it really wasn't happening in the Air Force at all. But I was stationed overseas, and I was a firefighter in a remote housing area with no medical coverage. So they trained some of us as EMTs. The interesting thing about that, and I was talking to Chief Beers recently, is that we saw back then what they're seeing today is that when the word got out that we were providing medical coverage as well, the number of calls we had, medical calls we had, was proportionally much more than fire calls. And that's, civilian fire departments today see that as well. And that part was kind of interesting. Excuse me. And then after having a lower back injury, I shifted gears in the Air Force, and I was retrained as a special agent in the Air Force Office of Special Investigations. Even then, I sort of took that medical training that I had, and pardon my phrasing, but whenever we had a case that was either somebody was dead or there was an assault, and anytime there was blood involved, they sent me as the case agent. So I kind of kept that training and that knowledge into that new job. But those experiences have stayed with me. Even as I became a mental health clinician, it sort of informed me, made me look at the person not just from a mental health standpoint. For instance, very early on, I started asking patients or clients things about their medical history. When was the last time they had a physical? Looking at things like pre-diabetic conditions, testosterone, thyroid, and that sort of thing. Because we know those are very clearly linked to mental health conditions also. So that's my
Absolutely. And I love that, already you had the experience, the personal and professional experience that you brought into counseling. And we've talked a lot among the DBH community about how we bring a very specific lens to the doctor behavioral health training, but also to healthcare in general, which is if we've had an experience personally or something that, has happened or impacted somebody that we love and care about, we see that as something that really needs to be fixed. So I think there are a lot of links between first responders and doctors of behavioral health. We too are sort of the fixers. And I think so often, we also see and are frustrated by the natural connections that we don't see happening, for a population that could have better health care. So, tell me a little bit about what's missing from your perspective in first responders and their care that they receive from a mental health perspective.
In part, yeah, when we're trained and when we're taught as mental health clinicians, we're sort of taught in kind of a linear way. I think, lack of a better way to put it. In other words, we see typical problems, and I mean we treat trauma. But usually when we are treating trauma victims, their experiences are limited to their traumas, where with first responders, they're experiencing trauma from multiple directions. In other words, they are dealing with other people's trauma, so we see the vicarious, the secondary trauma, but then also they are involved in the trauma. Going into a burning building to rescue somebody, they're putting themselves in danger also. And so that's part of the difference in when you're treating a first responder. You're treating their traumatic experiences from really two different directions. The trauma that they experience, and then witnessing other people's traumas.
Yeah, and I don't think a lot of people fully understand the experience of first responders. I remember I was working with an EMDR therapist in Phoenix, and she talked about how one of her, and specifically EMDR is eye movement desensitization and reprocessing, and it's a very effective therapeutic tool for those of you who aren't familiar with that out there in the listener world. It's a very effective tool for treating trauma. And she was sharing with me that one of her clients was a retired fire chief. And his trauma was every other intersection in town, because those were the spaces and places where he had experienced trauma that were unfortunately coming back up for him now that he was retired. And so, he had sort of put all of that trauma in a container during his employment and during his long service. And so in retirement, a lot of this was coming back up and making his life very unlivable, for him. And so she was talking about how they were really doing some great work in healing some of those long-term, chronic and repeated traumas, so that he could drive through intersections, without immediately being transported in time back to what had happened. So I don't think a lot of people think about that, and I know that it is directly connected with the much higher suicide rate for first responders. So can you talk a little bit about that, unpack that for our listeners? Because I think a lot of times, like you've mentioned, first responders are looked at as heroes. They are viewed, and the public perception of them is that they're very strong. They can take a lot. That it's just part of the job, and that, sort of they should be able to process and roll. But what happens for a first responder that would increase their risk of suicide?
Well, there's a couple of things. Like you said, being a first responder, generally you live in the community that you're serving. So that likelihood of when you're driving home, you may pass directly by an intersection where you were just treating somebody 2 hours before. It may have been a traffic accident with a fatality. So there's that aspect to it. They live where those traumas are occurring, but then also with first responders, be it law enforcement or fire, and they work shifts. It's those multiple exposures. It's you finish one call, you go back, you clean your equipment, and boom, another call comes in. And one of the things that Chief Beers and I talk about in the Fire That Burns Within training that we've been doing, we're going into our 4th year. That's hard to believe, but we talk about not only other traumas occurring frequently, but then when you also get this possibility that you're experiencing very similar traumas, one after the other, and so it's very cumulative, and we know that in studying. We've gotten really, really good at understanding and treating trauma for the average person. It happens. It's a one-time thing. If they're injured, they go to the hospital. They heal. If they're experiencing post-traumatic stress or PTSD, they develop PTSD. We're good at treating that. But with first responders, it's just ongoing. It's day after day after day, and most people, when they experience a trauma, they have that, lack of a better way to put it, that luxury of melting down. They have that they can just experience their trauma. First responders can't. When they arrive on a scene, the average person, when you walk up to a car wreck, they kind of recoil in horror. First responders can't do that. They have to maintain that professional persona, no matter how horrific the event may be. First off, that's the and they're fighting against the way our brains, the neuroscience of our brains was developed. That's what we naturally do. We kind of respond this way to trauma, where they have to maintain that persona, but then they have to go back to work, and then they may experience it again, and then another hour, and then in another hour. So it's just that ongoing traumatic experiences that they have to endure.
Right. And one of the things, that I learned from you early on, when you were doing your doctoral work at CGI, was I think there was an experience or a statement that maybe you or someone that had shared with you as a first responder about trying to go get mental health care as a first responder, and the clinician's response to that person was, well, it's just part of the job. Like, what did you think you were signing up for? So sort of like, pull yourself up by your bootstraps. You're a you're a fire person. Like, this is what it is. So either, stay in it or go get a different kind of job. I think that to me was the loudest warning bell, for the need for better education for mental health clinicians and physicians, to be prepared to meet a person who is experiencing this chronic, repeated, trauma exposure day after day, with empathy, and to be able to hold space in a healing way rather than confirm what the person is already telling themselves and has been telling themselves, which leads to poor mental health and a greater risk for chronic depression, chronic anxiety, complex CPTSD, these kinds of long-term experiences that increases the risk for suicide.
Mm-hmm. Yeah, you're right there. That the perception is, when you go into the fire service and law enforcement, but fire service, is that is part of the job. You're expected to suck it up. You're expected
Mm-hmm.
to experience these traumatic events, and for them to not have any effect on you. One of the
Mm-hmm.
trainings that Paul and I were doing here, it was one of the fire departments, one of the counties here locally, and we were very lucky, and it sent a really, really good message. But the chief of the department attended the training with the firefighters from his department. And at one point, he stood up and he made this really insightful statement. And he said, they show us the recruiting video, all these wonderful things that we're going to be doing as firefighters, carrying a baby out of a burning building and all these things. He says, but they don't tell us what's really happening, what those experiences are going to be like. And you have to kind of wonder, if they really did tell them, would they get people in, to come into fire service? And I think we do. We really would. It's just telling them
Mm-hmm.
up front. One of the things that Paul and I are starting
Yeah.
to see happen is, and it's a wonderful thing, is we're getting asked to present. We kind of shorten up the training that we do, but we're giving the opportunity to train academy classes, to tell them this
Oh,
is
good.
what you're going to experience. And just a week and a half ago, I taught at the Sandoval County Fire Academy, and it was a great opportunity. It was the day before they graduated, and it gave me the opportunity to really kind of send a very real message, is that the decision you make today about your mental health will impact the entire rest of your career. Whether you survive it, first off, and secondly, whether you come out the other end happy and healthy, like you deserve to be after serving your community so significantly.
Absolutely. I'm so glad to hear you say that. I know one of the things that inspires me so much about the work that you and Chief Beers have been doing in New Mexico is partnering together to do that education, to normalize, mental health as preventative care. Because if we brush our teeth so that we don't get a cavity, why can't we seek mental health care to keep our mental health good, so that we can keep showing up at our job to do, in the case of a first responder, the hardest job ever? Like you mentioned, just that response that every normal human being has to something terrible that has happened to someone else, that pulling away. In that moment, to be a first responder means to take that human response and put it somewhere. And, the idea that it will sort of just evaporate and go somewhere else and not come back in the form of an illness, or, a mental health crisis at some point, including, the easy buttons to get rid of that sensation, which are, drinking, drugging, harmful behaviors that lead down a path that could go towards suicide, could go towards a lot of different directions. So I think for you to be showing up in spaces where they are doing their initial training before they graduate and naming that, making it a thing, bringing attention to it before they go through that final milestone of graduation, is planting that seed of, this is normal and it is happening, and you are not only allowed to do something about it, but it will shape the rest of your career,
Mm-hmm.
to be actively and proactively and preventatively keeping your eye on this ball. It's so important.
And it's what's interesting about it is some of the people that have been in the fire service for years. One of the first classes we taught was down at a department in southeastern New Mexico, and it's kind of an isolated community. It's a decent sized community. They have a pretty good sized fire department, but they're pretty isolated, and so they have to transport medical victims sometimes 2 hours away. But in the training, we asked this question, and luckily one of the officers answered the question. One of the white shirts, what they call them, they wear the white shirts with the multiple
Yeah.
bugles. And so we asked this question: is like, would you treat a patient the way you treat yourself? And this captain raised his hand. Was like, of course not. That would be he said that would be selfish. Just led right into a wonderful discussion about why. Why is it selfish for you to treat yourself, to engage in self-care, for you to look at kind of mitigating some of those experiences, some of the traumas, just like the people that you treat. It was a great discussion, because we got really to the heart of it. Is that first off, you need to treat yourself just as well. One of the things that we really stress is that if you're not taking care of yourself, I mean, both physically and mentally, you're not being as effective on the job as you would be otherwise. We always, use the example of, if you tweak your knee or your back, you're going to go to the doctor because you know that you're not going to be able to perform as a firefighter. But if you have that tweaked brain, it's going to have that same effect. You're not going to be as effective. You're not going to be able to perform. And not only are you possibly endangering yourself, it could be detrimental to your team and the people
Absolutely.
that you're training as well.
Yeah, absolutely. I think you and I have had many conversations around this idea of like special person. I should be, more special than the other people, that I'm here to save.
Yes.
And to go back to your comment about I think it was you mentioned it was a chief who stood up and said, we're showing recruitment videos and images of the heroic things that we can and we want to do, but it's not showing some of the darker realities of what that does. And in my mind, I was thinking about a specific story from the documentary, that one of the firemen told. His name is Robert, about the call. The call is one of the reasons it's called that. The title is on purpose, because everybody has that one call that they never forget, and that lives rent free in their hearts and minds and souls forever, because you can't save everyone no matter how good you are. That's not how life works. That's not how human bodies work. And so to have that one call, and then to have no standard of care for yourself, just to expect yourself to be able to show up the next day and respond as if that call had never happened, is special person magical thinking. It's one of the things that we talk about so often in the mental health world. But I think you naming that as part of the training that goes along with preparing for a career in life saving it's so important to be able to break down that myth and to be able to name the thing that it is and how it causes harm to you and possibly others.
Yeah, and yeah, I'll raise my hand. I have that call from 50 years ago, and you're right. Everybody, if they're honest, and career firefighters have multiple calls, but most everybody can say, yeah, I have that one. When I first connected with Rio Rancho Fire Department, I met the chief at the time, and I was introduced to him. He was told that that I was a counseling student, but I told him, I'd been a firefighter as well. And very quickly, he started telling me about a call. He was from, I think, Lowell, Massachusetts, and it had happened, 20 years before. But
Yeah.
him knowing that I was a therapist in training, he started telling me about that one call from so many years ago. So yeah, it's a part of who they are. One of the things that we also talk about in the training that Paul and I do is part of the training and the characterological makeup of firefighters gives them certain protections, but it also places them at higher risk because they are expected to fix things. They kind of have that Superman persona, in that when they show up, people expect them to fix it. They can't always fix it. Patients die, houses burn, people lose their entire, everything that they own, and there's nothing you can do about that. And that goes against who they are as firefighters and paramedics, because they're expected to save every time they go out, but that just doesn't happen. So there's that kind of erosion of that protective layer of we failed somehow, regardless of what they do.
Yeah. Yeah. Well, and I think one of the things I love so much about the call is seeing all of the ways that despite all of the things that can go wrong and do and have, and I think one of the things that really inspired you and Chief Beers to move forward into this direction was a suicide or two suicides, I believe, within the Rio Rancho team, one of which was a peer support professional, right?
Correct. Yeah.
And so, knowing that that can happen right at home and did happen right at home, and out of that, awful experience of that, you two moved forward, took action to say never again, and to prevent, the things from moving in that direction by banding together and creating this educational curriculum for recruits and for fire and first responder response teams. And I believe, tell me if I'm wrong here, but you're partnered with New Mexico Suicide Prevention. Is
Yeah.
that right? Is that the
Yeah.
right organization?
Yeah, the New Mexico Suicide Prevention Coalition. It's it's sort of it's connected, but not an official part of the New Mexico Department of Health.
Okay. And then there's also the Yellow Rose campaign, and I know that one is very important to the movement. And can you talk a little bit about that campaign and what it means to you and to Chief Beers?
Yes, it was a campaign that was started out of West Bloomington, Michigan, and it was started by the fire chief there, and it started out kind of as kind of a simple but really straightforward concept in that there's the Yellow Rose Pledge, and it's basically a firefighter or EMS standing up and in front of their brothers and sisters in service and making the pledge to not only have their back, in other words, be aware of the mental health effects on those on their teams, but their own mental health.
Right.
And it's just really straightforward. And then we give them a challenge coin that goes along with it. But it's very meaningful. Paul and I saw this, how powerful it could be when we first started kind of building the concept of the training that the fire that burns within training, and this has gone through multiple evolutions. We gave a presentation at the New Mexico Fire Chiefs Association It's coming up on 4 years ago now. And at the end of our presentation, we just got up and said, this is what we want to do. And we decided to do the Yellow Rose Pledge. And so we had this big conference room full of old crusty fire chiefs and some young crusty fire chiefs.
They could be old or young, but also crusty. I
Yeah,
love it.
they're always crusty because, and when we talk about, firefighters having to build up that hard outer layer to be able to do the job that they do. But that layer does two things. It can be helpful. In other words, it can kind of help protect you from those emotions, those experiences, but they can also hold them in. They can be
Yeah.
I don't want to say destructive, but they can stop people from being able to reach through that crusty layer.
Yep.
But we do it individually. Sometimes we do it as a group, but in this particular case, we had people line up and they would get up and come, and we had multiple people in the room that would do the pledge with them. And we saw so many tears, so many chiefs just saying, we should have been, we should have been talking about this a long time ago. And one
Yeah.
particularly old and crusty chief got up and he said, I've told my firefighters over the years that you just take those experiences and you put them in a box in your head and you just lock them away. And he just sort of looked off into the distance for a minute, and then he said, one day that box is going to break open. And that was extremely powerful. I mean, we each of us took away from that, like, we're on the right path here. We need to do this. We need to push forward. We need to make sure that we can provide this training and raise the level of awareness in whatever way we can. So that's was 4 years ago.
Yeah. I love that. And just, everything that you have done, since that point and before that point has led to some really beautiful things in New Mexico. And it's definitely, it's inspired me quite a bit because I think, and we kind of talked about this, that there is to me a similarity between a DBH and a first responder. I think a lot of doctors of behavioral health are like first responders in that other people would see a mess and want to run the other direction, but a doctor of behavioral health will see a mess and want to run straight into the fray to fix it.
Yep.
And we don't always take care or excellent care of ourselves, in the process of that, because our passion is so strong for helping others and for fixing and righting, a sinking ship. But to me, the effort that you have been doing, you and Chief Beers and Laura from the New Mexico, suicide prevention, and the many others that are part of the collective efforts in New Mexico are doing something so inspiring, because what I've learned from you all is that there is a lot more power when people with passion are joining together to do collectively what, one person can't do alone. You have a lot more impact. You're able to reach, rural communities that have no funding, because you're able to get, funding from here and stretch it to cover there. Or you volunteer because you just show up because you're just that passionate about getting the message out there. And I know you and Paul Beers have both done a lot of that. And not to say that we all deserve to be, not paid for our efforts, but I think there are just some things that are just worth doing that keep us in a healed place, instead of waiting for the world to recognize and see things as important as we see them, and therefore compensate us or find the money for it. We just say, if it's a thing that needs to be done, like Nick Cummings has long said, you find the need and fill it. So, sometimes that means you go and do it. And that's what I am so inspired by, is that, you and Paul and Robert and many, and Laura and the many others have just said, we're just going to go and do it. We're going to figure this out. It's a good thing that some funding has come along and has been directed, thank goodness, But I also think it's just so cool that you've made such a dedicated, and collective effort at this, and that you're recruiting, folks along the way, because it is so important. And this is a group of people that is very, very important. Not everybody can do the job of a first responder. So my goodness, don't we want to protect that population of people and provide them with the support that they deserve?
Yeah, yeah, absolutely. And uh, one of the I would say one of the things, but having gone through the DBH program and always being challenged to find a different way, find the resources, look at a problem from a different direction, innovate, just don't take what's been done before. Don't be complacent about what's been done before. Find a different way, and part of the connection to the documentary is one thing it talks about is yoga and all these different ways of addressing trauma, and I will admit I'm a slow learner, but Paul has really been into this, but kind of coming at the direction of a DBH. I started looking at the neuroscience behind it, and it's like, well, wait a minute. I mean, it's something as simple as meditation and making that om. And I was just reading this, just a couple of months ago. It's like what that om does in that meditation is that is stimulating the polyvagal nerve to calm down. It's
Yep.
like, I didn't know that. So we have, like I said, when the training is an evolution, so we've started talking about that now, what the autonomic nervous system and breathing and how to calm yourself. I've even incorporated that into my EMDR sessions. I start sessions with
Incredible.
polyvagal breathing, and we will do that in our training. We'll talk about polyvagal breathing and being able to do that as they're going to a call. So
That's incredible. What a great idea. I mean, how having, long, long ago when I was an undergraduate student, I took a yoga class, never thought, anything more than it would be good exercise. But learning how to do that polyvagal breathing changed my life. I needed that so much. It came to me right when I needed it, and I have used it throughout my life. I used it during pregnancy and, childbirth. I've used it during many a crisis call, almost every crisis, personally and professionally that I've experienced since I learned how to do it. So I can definitely relate to how well that would work for setting yourself up, in preparation to arrive at a call.
yeah, yeah, and Paul accuses me of nerding out about the neuroscience, but
How can you not? It's so interesting.
I know.
It's so cool.
It really is, but it also, I think, and especially the first responders that are medics,
Yes.
they really connect with that when we talk about the nervous system, and the ventral vagal system and or the dorsal vagal system, and what they do when people experience, and they can even do that. They can even adopt that with patients in the field. They can
Absolutely.
do vagal breathing with somebody who's experiencing a trauma. So we found it's kind of that synergy that Paul and I bring to the training is one of us will come up with an idea and the other one will go, "Are you kidding me?" And then we'll turn around and then we'll each look into it and go, "Okay, yes, we knew what you were talking about all along." And that's really kind
It's the
of,
beauty of partnership and a good partnership.
and that's part of the documentary as well. Is when Charlie first reached out and said, "Hey, Dr. English has been talking about this training that you guys are doing," and so it started out as want to do a documentary about the training. It's like we're like, no, it's not about us. It's about the New Mexico firefighting community and in the EMS community. And we were really happy to see that the documentary kind of encompassed that and all the different aspects and the things, the different facets of not only what they do, but then what we can do as a mental health community to support them. So
Yeah.
it's really a kind of a wonderful evolution.
Yeah, it gives me goosebumps really to think about it, because it really is, if a group of DBHs got together and said, well, what could we do? Sort of like our little way of getting together and go, well, scrap everything that's already been done. What could we do? What should we do? What's the science say? What are our resources? How can we pull this? How can we build it? Who can we get to work together? How quickly can we get a pilot going?
Yeah.
And I love it because, one of the other things that we haven't mentioned yet that I love so much is the gym space that's there. I believe it's in Albuquerque, where, folks can go and just be quiet, just have a silent, neuro-regulating, place where they can be safely quiet. And there's also a dog,
Yes.
right? And that to me, for our son, we have a son who's 20 who, is on the autism spectrum. And one of the things that is and always has been so important to him for neuroregulation is a dog, one or two dogs, having them directly on the body and doing that polyvagal breathing that he probably wouldn't call it that. We've maybe never pointed out to him that that's what he's doing. But just that, co-regulation, and having a space where if that's your thing, you can go and do that as a first responder and you'll be met with a safe, understanding space. Critical.
Yeah, and that's one of the things that we really stress, because when we designed the training, we very purposefully, and we even actually had a firefighter in one of our early classes come up to us and say, I really like the way you guys designed this class. And we were very intentional when we designed it. You've got to talk about the organization. You have to talk about trauma when you're talking about suicide and you're talking about first responders and what they experience. You have to. But it's really important not to leave them with that. And so the last module is we talked about self-care and resilience. And a lot of these rural communities, they don't have these gym spaces. They don't really have anything. So
Right.
we talked to them about how do you build your resources? What is important to consider. And one of the things we ask them is like, what brings you joy? And
Yeah.
you really need to focus on that. Identify what brings you joy. And then I get to talk about the neuroscience of why it's important, because bringing you joy helps your brain, that neuroplasticity of the brain, and helps your brain heal from those traumas, and why it's so important that they do that. So
Absolutely.
we're getting the message out there. We hope. We think we are.
Well, I think you definitely are, and I think the film is definitely a celebration of all that you have done and all of the potential and all of the growth, that will just be, expanding from today, from definitely from when the film was produced. But it's very exciting to be finally having the premiere happen in Albuquerque in June. And it's not exactly open to the public, so that's not what we're advertising, but we definitely are celebrating the fact that, the film is done. It's coming home to have a showing among that amazing, thriving community that you just mentioned. And I get to see you in person, which is always an amazing thing. And I get to see Paul again, and I'll get to meet Robert and Laura for the first time. So I'm really looking forward to all of that. And I believe that we also have our doctor behavioral health student, Heather Rice, who is a trauma expert and who is also in the film and speaks to the role of trauma and some of what you've just been talking about with, the sort of the neurological and psychological and emotional aspects of trauma. She may also be in attendance. So it'll be a great opportunity for doctors of behavioral health to come together and celebrate with the community.
And who knows what will happen from there?
Oh, who knows? We're going to get in some kind of trouble. That's all I know. So, I think one of the things that I love so much about everything that you're doing is that there are so many communities, I hope, that will see the film and get inspired. My family and I live in Portugal right now, and right in the center of town is our big fire station. Here in Portugal, we call them bombeiros.
Yep.
And so the big, but they're such an integral part of the community. And I don't know how much medical work that they do, but we don't have a hospital. We have a clinic. We don't have a hospital. And so, we see them out on calls. And every time I see them, I think about the work that you all are doing, because it is a small town. I mean, it's a town of 25,000. But I know that their service is very busy. So, I think that there are just so many communities who can take ideas from what you have been doing and learn how to make those work in their communities.
Yeah. There's a lot of work out there to be done. And I don't know if we told you that it's kind of an offshoot of a presentation that Paul and I gave at a conference last year. So we're going to next week. We're going to Nashville, Tennessee, to the fire department there. And so we have 2 days. We're doing the same training 2 days in a row with the National
That's fantastic.
Fire Department. So we're sending the message to Tennessee as well.
Fantastic. I mean, everywhere, everyone, everywhere needs to know more about this. I certainly hope that more of the mental health community will take note and pay attention and look at how they can become better at meeting first responders with a more supportive and trauma-informed approach.
Yes, absolutely.
That's something that you and I talked about from the get-go. I think that was probably one of the first things that we ever talked about. So, I definitely want to see that. I want to see better health and the lower suicide rate, and, just better lives, better thriving health for those who are doing so much to support everybody's health and lives. All right, my friend. Well, I want to thank you for your time and for everything that you're doing, but especially for taking the time out of your day today to talk a little bit about the efforts. And the next time we see each other, it will be in New Mexico. So, hey, I'm coming to New Mexico, and I'll see you soon.
I'm looking forward to it.
Yeah. All right. Well, thank you so much for everything. And I really look forward to getting together so that we can celebrate the film and just the wonderful community work that's being done in person.
Sounds great. Thank you.
If you enjoyed this episode, don't forget to subscribe and share. Let's keep disrupting healthcare together. Until next time.